हो गया। Good afternoon, all. A warm welcome to another session of the lecture series organized by Shiva Ayurveda Medical College and Hospital. Today's topic is role of Rasa Shastra in clinical practice. In my opinion, is a very important topic to be discussed as the real potency of Rasa medicine is not being properly explored or used in our clinical practice. We are very privileged to have Dr. Madhava Diggavi, speaker, who is a well-known Ayurvedic practitioner, especially in Rasa medicines. He is a HOD and professor, head of the Department of PG Studies of Kachikilsa, Taranath Government Ayurveda Medical College, Bellary, Karnataka. He has done his UG from Ayurveda Mahavidyalaya, Hubli, and PG from Gujarat Ayurveda University, Jamnagar, where he has done his thesis on Vajikarana with special reference to Uttaravasti. He has presented over 3 international papers and 10 national papers, and his 22-year-long experience in the field of Ayurveda as a clinician and a teacher with over 90,000 patients is what we are going to explore and learn in this session. On behalf of Shiva Ayurveda Medical College, I welcome you, sir.
Thank you. Thank you, Dr. Balendu. Shall we start?
Yes, sir. Yes, sir. Yes, sir.
Okay. Medical College. And thank you, Dr. Balendu Krishnan, for introducing me very well. And my dear delegates, friends, teaching staff members, practitioners, and students. It is my immense pleasure to share my experience on role of Rasa Shastra in clinical practice. Many a times, there is a demarcation between Rasa Shastra, Bheshya Kalpana, and also Dravya. For me, all the pharmacological departments, including Rasa Shastra, Bheshya Kalpana, Dravyaguna, are all Rasa Shastra itself. In the broad spectrum, the Jangama and Sthavara Dravyas, they fall into the Rasa Shastra group. Everything in the world can be used as medicine, and we can use in our clinical practice various Rasa medicines. Rasa is the most synonym of Parada. Rasa is Navarasas. Rasa is for Shadrasas. So in such way, all substances who have Shadrasa can be taken in the purview of Rashastra. That's why what we can see is the Atharva Veda and Rigveda are basic for Ayurveda. The 1,000 shlokas, Shata Sahasra shlokas, are branded into 8 branches of Ayurveda. So Ashtanga Ayurveda brought into the practice. Rasa Shastra, which contains Bheshaja as one of the Chikitsa Chatushpada, medicine and medicine preparation are all connected to Ayurvedic practice only. Rasa Shastra is for our practice. Bheshaja is for the treatment of the patients. Ashtanga Ayurveda has got 8 branches of Ayurveda for our easy management of treatment. There are 3 distinct origins of Rasa Shastra, as you all know: Dehavada, Dhatuvada, and Chikitsavada. Dhatuvada for conversion of lower metal into higher metals. Conversion of lower metals into higher metals. Whereas Dehavada is for treatment purpose. Chikitsavada is in particular for the treatment of patients only. From the Satya Yuga, Treta Yuga, Dwapara Yuga, the development of Rashastra can be seen. The Bharadwaja brings Rasa Chikitsa, and in Ramachandra, Bhairava Tantra, Ravana Krita Tantras, Rasa Shastra was brought to the earth. And in Kali Yuga, we are really in the current Yuga, we are practicing Rasa Shastra and Ayurveda. Rasa Shastra is Rasanat Sarva Dhatunam, Rasa Ityabhidiyate. Whichever is perceived by the tongue, mercury or shadrasas are all connected to Rashastra. The Adi Vishak is Rudra and Siddha Nagarjuna. During the period of Siddha Nagarjuna, 8th and 9th century AD, the Deha Siddhi and Loha Siddhi were much practiced. So Nagarjuna says, Siddhe Rase Karishame Nirdaridra Gadam Jagad or Nirdaridra Midam Jagad. And this Dehavada is designated as Rashastra and Rasatantra. After the Mercury, this was behind the development. The Rasa Shastra introduced yantras, samskaras, kalpas, and giving a quantum jump to the field of Vaishesha Kalpana. Dravya is of 3 types: Bhaumam, Audbidam, and Jangama. In clinical practice, we use all the 3 categories of Bheshaja: Bhaumyam, Audbidam, and Jangama. Complete utilization of Bhaumya Dravyas through different Kalpanas is possible. So in the Bhaumya Dravyas only, many of the Rasa Shastra Aushadhis are coming. Even though there is difficulty in standardization, the Grahya Lakshanas and Siddha Lakshanas have been explained in the textbooks of Rasa Shastra for the benefit of consumers only. Rasa Chikitsa is broadly, we use in practice is Kupi Pakva Rasayanas or Kupistha Rasayanas, Parpati Kalpanas, Potali Kalpanas, and Khalvi Rasayanas. Maximum usage of Khalvi Rasayanas and Parpati Rasayanas and Kupi Pakva Rasayanas are in my practice. Of course, Potali Kalpas, whenever we get Potalis, we also practice that. In Rasa Shastra, when we practice Kupi Pakva Rasayanas, many of them are combination of Parada Gandhaka. So this Kajjali or Rasa Sindura, mercuric sulfide, which is in a safe form because Shodhita Parada and Shodhita Gandhaka are used. Hence, they are not a toxic combination of HGS. It is a safe combination of HGS. Parada, Gandhaka and other metals like Tamra, when we add, Rajata we add, then it becomes Tamra Sinduram and Rajata Sinduram. Tamra Sinduram is very clinically useful in case of bronchospasm, acute bronchial asthma and bronchospasms. Rajata Sindura can be used in case of Parkinson's disease, even in case of COPDs, obstructive airway diseases. Parada, Gandhaka and non-metal compounds like Malla Sindura, Thala Sindura, Shila Sindura. So Malla Sindura is useful in case of neurological diseases like Pakshagata, cerebrovascular accidents. Thala Sindura is effective in case of Kushta, Many skin diseases like psoriasis, lichen planus, in such conditions, Thala Sindhura is effective. Shila Sindhura is effective in case of bronchial asthma, bronchitis. Nirgandha Murchana like Rasa Pushpa and Rasa Karpura, in which I use Rasa Karpura for the purpose of sexually transmitted diseases, gonorrhea, chronic cystitis, urethritis, nephritis, in such cases we use. In one of the clinical use, post-COVID complications, we have used Rasa Karpura for the purpose of the pneumonia and basal consolidation or ground glass appearance in X-ray or MRI scan. In Corads 5, Rasa Karpura yogas, Rasa Karpura was administered with Shastra yogas. Then we are having a breakthrough. Parpati kalpas like Swarna Parpati, Tamra Parpati are effective in case of IBS. Abra Parpati and Loha Parpati are Sagandha Murchanas. In Nirgandha Murchana, Shweta Parpati and Mala Parpati comes. I commonly use Shweta Parpati in clinical practice. One of a promising drug for cystitis. Whenever the urinary bladder is having thickness, there you can use, or in case of renal calculi, in case of hepatic colic, due to the cholecystitis and cholelithiasis, Shweta Parpati is found very effective. It is Vatanulomaka. Being a Kshara, it is effective in scraping action. The preparations made from Parpati Kalpas are mainly used in Grahani Ashrita Rogas. So Shweta Parpati should be one of the best practice in nephrology. We use for nephropathy cases in our hospital the Shweta Parpati based kalpas for pedal edema, the congestion, pleural effusion, patient is having difficulty in breathing due to the nephropathy. One who is on dialysis or who is not on dialysis, Shweta Parpati Yukta kalpas are very effective. Potali kalpas are Parada, Swarna Basma and Mukta Basma and Shuddha Gandhaka. When they are taken in equal quantity and made a kajjali, and after that it is mardana is done with aloe vera juice, kumari juice, and in a silk cloth it is submitted to the sulfur bath. Then potali kalpas are available. We commonly use in practice is the hemagarbha potali. Whenever there is pulse rate is declining, when BP is falling, patient is going into the crisis of cardiac shock, then hemagarbha potali is effective. When you are unable to feel the pulse of a patient, direct use of hemagarbha potali, 10 rounds which is rubbed on the stone and it is applied over the sublingual area, patient starts getting cardiac activity and pulse rate. In emergency condition also, hemagarbha potali can be used where patient is having cardiac ailments, ischemic heart diseases, angina pectoris, unstable angina, acute coronary syndrome. In all these conditions, we use hemagarbha potali as a common use. In some of the patients who are having cardiac beat is declining, bradycardia is taking place, so hemagarbha potali rasa is very effective. And maximum Karliya Rasayanas or Kalvi Rasayanas are in practice, where Karliya Rasayanas are prepared by Mardana of the ingredients either with heating or cooling method, and this Kalva is used and Mardana is used, hence it is called Karliya Rasayanas. So in Kupipakwa Rasayana, Rasa Sindhura is found effective in case of testicular regeneration properties. Rasa Sindhura with the use of the Bhasma like Makaradhwaja or Rasa Sindhura alone, or you can use the Rajata Bhasma with Rasa Sindhura, or Rasa Sindhura can be mixed with Vajra Bhasma. It is a classical preparation, only 2 ingredients. Rasa Sindhura mixed with Vajra Bhasma is very effective in erectile dysfunctions. People are not bothered about the cost nowadays, and this yoga is very effective. The Makaradhwaja Rasayana is a promising spermatogenic drug and cardiac tissue regenerative drug. Makaradhwaja vati should be mixed with honey and it should be triturated or mardana is done in the kalva, and then sublingual administration of Makaradhwaja is equal to any drug like sorbitrate. Sublingual action of Makaradhwaja is seen. And when patients are in coma, then also Makaradhwajavati and Bruhadvata Chintamani Vati are very effective. Siddha Makaradhwaja is a Vajikara yoga. Whenever male patient is having erectile dysfunction, Siddha Makaradhwaja can be used. Shila Sindura is a Kupipakva Rasayana effective in bronchial asthma. Malla Sindura is a very effective drug in capillary hemorrhages or capillary oozing, cerebrovascular accidents, Pakshagata, patient who is having subdural hemorrhage or cerebrovascular infarction, anterior cerebral artery or middle cerebral artery infarction is there, and severe stroke patients are there, Pakshagata cases are there. In recent trend to tell, post-COVID infection, the cerebrovascular stroke is very common. In such case, Malla Sindura and Samira Pannagarasa are promising drug. And for post-COVID pneumonia and corona pneumonia like conditions, Samira Pannaga is a very effective Kupipaka Rasayan. It acts on lung tissue degeneration, consolidation, or ground glass appearances. Even Corad 5 stage also we are trying now with Samira Pannagarasa. Rasa Karpura is also a very effective remedy in case of Kleda, Kushta and Shwasa Pranavasruta Svikaras. The Kalvi Rasayana like Swarna Basanta Malati or simple Kajali. You can use Kajali as one of the Yogavahi catalyst for any drug you are using. If you want to reduce the dose of the churnas and you want to enhance the effect of the churnas, Kajali should be added to the drug. Simple drug, I'll tell you, if you add Kajali to the Haritaki churna, the 12 grams of Haritaki churna can be reduced to 1 gram. Or Kutacha Kajali can be prepared. The Swargiya Mama Gopte from Pune Tilak College, who was ex-dean of Gujarat Ayurveda University, developed this. The Kutaja Kajali and Sukshma Trifala were developed. See, adding Kajali to Trifala Churna, it becomes Sukshma Trifala. Mardana is done. Then the dosage of Trifala becomes reduced to 500 milligrams per day. And the quick action can be expected. So, Vasanta Kusmakara Rasa is a promising drug for metabolic syndromes, where pre-diabetic, diabetic, and post-diabetic complications can be used. And Yogendra Rasa is effective in case of Pakshagata. Krishna Chaturmukha Rasa can be used for the quadriparesis or paraplegia. And Arogyavardhini Rasa is a favorite Kalvi Rasayan in my 22 years of practice. Anupana Vedena Sarvarogaharam. So many Arogyavardhini patas are there, but the commonest available is Kushta Chikitsa and Meha Chikitsa part of Arogyavardhini Rasa. Arogyavardhini is a Kalvi Rasayana with Tamra, Abraka and Loha, along with Shilajito and Kajali. This Arogyavardhini Rasa is a very good Rasayana Prayoga in case of any skin allergies, the liver function disorders, fatty liver disease, or ascites with the cirrhosis changes in the liver. Arogyavardhini Rasa is effective. Arogyavardhini can be one of the best drugs to use in cholesterol metabolism disorders. See, if you give Arogyavardhini, the proper cholesterol metabolism takes place. Hence, the manufacturing of dopamine and testosterone takes place properly. When patients of andrology comes, where testosterone synthesis is not proper, their Arogyavardhini Rasa is effective. When muscle and vessel metabolism is in trouble, cellulitis is there, infectious and non-infectious, non-communicable diseases are there. There also atopic dermatitis, the chronic allergic dermatitis. In such cases, Arogyavardhini can be used. Arogyavardhini is a Kushtagna, Mehagna, Rasayana drug. It can be used for GI tract disorders. It can be used for liver and gastrointestinal tract disorders. Arogyavardhini can be used for dermatology practice. Arogyavardhini can be used for any Dhatvagni Vikaras. So, Bhalataka and Arogyavardhini are two good combinations where you want to practice the Dhatvagni Mandajanya Vikaras. In Parpati Kalpas, commonly used is Panchamrita Parpati. Panchamrita Parpati is very effective in case of inflammatory bowel disorders like IBS-C or IBS-D. When patient is having IBS-D, IBS-D is a diarrhea dominant IBS, their Panchamrita Parpati is very effective. Mucoid colitis or giardiasis, which are rare in clinical practice now. Still, if the case is available, Panchamrita Parpati is very good choice. Any bowel disorders, Panchamrita Parpati is a rasayana to the bowels. It can be used. So, in case of Tamragarbha potali has been tried for atherosclerosis of cardiovascular diseases. It is a potali rasayana. Tamragarbha potali is very effectively removes the atherosclerosis and plaques in the arterial circulation, and hence can be used in case of Dhamani Pratichaya or Dhamani Kaఠిన్యత, atherosclerosis, arteriosclerosis, and hypertension. Hypertension is very common secondary to diabetes or secondary to dyslipidemia and hyperlipidemia. In such cases, Tamragarbha potali can be used to do the proper circulation of blood in blood vessels. Post ischemia or infarction, Tamragarbha potali can be used. See, if we come to the Bhasma in clinical practice, the influence of Shodhana on Bhasma is very important. The drug used for Shodhana, Bhavana, Marana makes a very important distinction in practice. Whenever Abraka Bhasma is prepared, the Shodhana Dravya used for Abraka Bhasma Nirmana, Bhavana Dravya used for Abraka Bhasma Nirmana, and Marana used for Abraka Bhasma Nirmana, all are going to play important role in clinical practice. So, if you are using Abraka Bhasma for hemoglobinopathies, Pandu group of spectrum of disorders, then Shodhana, Bhavana, Marana drug should be Pandu Haraganas. If you are using Abraka for anti-cancer property, then Shodhana, Bhavana, Marana drug should be anti-cancer herbal medicines. If Abraka Bhasma is prepared for Vrisha effects, so one of the Kerala company prepares Abraka capsule, Abraka Bhasma capsule. It is for Rasayana property. 90 herbal drugs are used for Bhavana. So the drugs used for Bhavana has a clinical significance in practice. So if your purpose of using Abraka Bhasma for diabetes mellitus, then Darvyadi Kashayam, Suradarvadi Kashayam, Trifaladi Kashayam, Falatrikadi Kashayam, Kataka Kadiradi Kashayam, Nisha Malakyadi Kashayam. These dravya should be used for Shodhana of Abraka, Bhavana of Abraka, and Marana of Abraka. So this is one of the contribution of Rasa practice, Rasa Chikitsa. It makes a distinct drug level absorption and drug kinetics as per its manufacturing. So the manufacturing methods in Shastra are, if you see for Abraka, Shodhana, Marana, Bhavana, there are so many options given in Shastra. Why so many options are given is as per the clinical application. If you are using Abraka Bhasma for degenerative diseases like Alzheimer's disease, the Brahmi Vachadi Kashaya Bhavana is very effective. Or Shweta Aparajita Mula Bhavana for Abraka is effective in case of depression and anxiety. So Bhasmas have got a very significant role to play because they are in nanoparticle size. This is a nanotechnology. Rasa Shastra is the first science in the world to give nanotechnology to the either industrial or health related practices. If you come to the Nirvapa, the heating and quenching, immediately after heating, linear expansion takes place. After immediate cooling, the tension is decreased and increase in compression force is there. So repetition of heating and cooling makes a disruption of compression tension equilibrium and increased brittleness and reduction in hardness and improvement in particle size takes place. So you are converting hard metals like platinum or gold or copper. These are very big metals. By means of Nirvapa, they become very small particles. So the Nirindriya Dravya is converted into Sendriya Dravya. The nanoparticles are very active Sendriya Chetana Dravyas. The hard metal is not that. So the Rasashastra concept of Nirvapa helps us to make Nirindriya Achetana Dravya into Chetana Sendriya Dravya. Then we can use it in clinical practice. Abraka Bhasma is Abraka nanoparticles. Tamra Bhasma is Tamra nanoparticles. Rajata Bhasma is Rajata nanoparticles. You can see nowadays The soaps are containing Rajata molecules. The sanitizers are mixed with zinc and Rajata molecules. So they have got a disinfectant concepts where they can do antiviral property and antibacterial property. It is because of nanoparticle size of that bhasma. So bhavana, it is going to help the conversion of quartz powder to finer state. And bhavana facilitates further processing into marana. So bhavana drug, see if you give amalaki swarasa bhavana to amalaki churna for 7 times, we have done clinical trial. If you use amalaki swarasa bhavita amalaki or amalaki kashaya bhavita amalaki churna 7 times or 14 times or 21 times, the electrical force in the amalaki churna increases. In case of asthenozoospermia, where the mitochondria of the spermatozoa is having a defect, they will develop very good active motility in spermatozoa. So, spermatozoa motility disorder is called asthenozoospermia. Their bhavana of amalaki kwata or amalaki swarasa in the season to the amalaki churna itself. Vidari Kanda Swarasa Bhavana over the Vidari Kanda Churna is going to enhance the semen volume. The semen pH will be improved. Vidari Kanda is a Parama Vrusha for Shukrava Srotas, where there is a degeneration in the seminiferous vesicles, seminiferous ducts. There, Vidari Kanda Swarasa Bhavita Vidari or Amalaki Swarasa Bhavita Amalaki, very good Pitta Shamaka, and it is going to enhance the motility of the semen. So like this, we are able to use the Bhavana concept of Shastra in clinical practice. The concept of Marana. Marana is responsible for feasible changes in the Bhasma, where it is increase in number of putta, decrease the size of the particle. If we give more and more putta, in Shastra we have concept of, see, Naga Bhasma can be prepared in 30 puttas. But if you can prepare Naga Bhasma in 90 or 100 puttas, the particle size becomes nanoparticle. So Rajata Bhasma can become nanoparticle. The Marana is going to convert the metal into nanoparticle. Under the room temperature, Ayurveda Rasa Shastra can only do this magic. And the number of increased putta will decrease the particle size, so the harmful of the metal is decreased. If the particle size is nanoparticle size, it will not be harmful. The conjugation of trace element takes place by Marana, elimination of impurities takes place by Marana, formation of desirable compounds. Ligands and compounds are prepared by Marana. So biologically available compound is prepared by Marana. So Ashodhita metal is made into Shodhita metal, powder of the metal, Bhavana is given, Chakrika is prepared, Sharava Samputa is done, Putta is given, and then Bhasma is prepared. Bhasma is Apunar Bhavan. In Bhasma stage, the metal will not come back when you are going to check it or administer in the body. Bhasma is not metal. See, the modern pharmacology, people are giving so many metals and trace elements to the pregnant women. Selenium, the tungsten are given for antenatal period. And we are better than them because we are preparing Mandura Bhasma, Loha Bhasma, Shataputi Loha Bhasma we are preparing. The Loha Bhasma is effective, but Shataputi Loha Bhasma is very effective in ocular disorders, retinal disorders, and pregnancy disorders. If you mix Shataputi Loha Bhasma with Devadaru, Churna, and Chandraprabhavati or Garbhapala Rasa, if Shataputi Loha Bhasma is added, then it will cross the placental barrier. If you put Shataputi Abraka Bhasma or Sahasraputi Abraka Bhasma, they can cross the blood-brain barriers. And then their efficacy is enhanced. The dynamics and kinetics are more better. So the Bhasma is having properties like Rasayana, Yogavahi, and Bhasmas have got very effective in a very low dose. In 30 milligram dose only you are able to administer the Bhasma, whereas Kashtaushadhi is 12 grams, 24 grams dose is there. And Shubhra Vyapti, the Bhasmas will disperse in the body very fastly because of their Shikra Vyapti Guna. And they do, the microcellular Agni will be improved by Bhasma. So I call every cell of the body has got Agni. Every tissue has got Agni, every micro cell has got Agni, DNA has got Agni, chromosome has got Agni. If you want to reach to the level of the mitochondria or chromosomes or DNAs, the proper Bhasma Nirmana is it is a very essential factor. Of course, There are so many toxicological studies coming in the market. They are because of improper manufacturing methods, or not following the classical methods, or shortcut methods practiced in industry. No shortcuts are good in Rasa Shastra. If it is told to be given 60 putas, 60 puta must be given. A trial was conducted under Dr. B. Ravishankar in Gujarat University, where it was noticed that the 20 putas abrakabasma was having toxicity, whereas 30 putas prepared abrakabasma was not having toxicity. So the number of putas increased, the marana increased, their toxicity level comes down. So the general practitioners in Ayurveda, just immediately passed out BMS graduates in Ayurveda, can easily practice this. The Basma contains Varitaratvam, Rekha Purnatvam, Unnamatvam, Slakshnatvam, Sukshmatvam, Anjana Sannibatvam, Anjana Sanniba Varnatvam, and Nischandratvam. These are all Apunar Bhavatvam and Nirutthatvam are the safety profiles in Rasa Shastra and classical methods to identify the Basma's safety in practice. Nanomedicine, if the particle size is 0.1 or 1 to 100 nanometers, then it is called nanoparticle. This nanoparticles target specificity is very high, encapsulation efficiency is very high. Nanoparticles are very good in carrying high concentration of the drug. The nanoparticle takes efficient drug release system, and the ability to cross the blood-brain barrier increases in nanoparticles, and reduction in peripheral side effects of the drugs by decreasing overall dose of the drugs is done by nanoparticles. So the Basmas prepared classically are working as nanoparticles. The physical, chemical and biological methods are there. The technology has developed that EDAX or atomic absorption spectroscopy, X-ray induced photoelectron spectroscopy or very good electron microscopy methods are there to find out the nanoparticles of Basmas. Swarna Basma is having 56 to 57 nanometer size, so it is very effective. Swarna Vacha Prashanam or Swarna Prashanam are very effective in case of nanoparticle technology. The Swarna Basma was analyzed qualitatively through XRD and FTIR, and results showed that final product is almost pure aurum in zero valency state. So no fear, my dear practitioners, if the Basma is properly prepared, you don't get afraid. Whether kidney is damaged or heart is in trouble or brain ischemia are there. If the nanoparticle is properly prepared by classical method, we can practice. Yashada Basma, oxygen deficient state and are in nanometer size. So Yashada Basma, zinc, even though zinc oxide is prepared by Ayurveda, it is a safe zinc oxide. Whereas modern zinc oxide is different than Ayurvedic Yashada Basma zinc oxide. I want to quote a very important clinical significance of zinc in practice. See, zinc has got antiviral property. In COVID season, when many of the Western articles are published, zinc is very good for the COVID-19 prevention, prophylaxis, and also post-COVID-19 infection. And Yashada Basma is very effective in Vajikarna. We come across some of the patients where they come with erectile dysfunction and low sperm count. And nowadays we are checking the zinc levels in the serum and zinc is decreased. The patient of erectile dysfunction is having low zinc levels, less than 70 nanograms. And some of the patients with low sperm count are also having zinc deficiency. And alopecia patient, today morning only we had a patient of alopecia. The patient is having low zinc levels and low copper levels. See the problem, trace elemental deficiency is a cause for alopecia or hair fall. When you are treating a patient of alopecia or hair fall, kindly evaluate serum zinc and copper levels. If zinc and copper level in the form of ceruloplasmin is decreased, it is Wilson disease. Annually, I get 2 or 3 patients of Wilson disease, and there we see either ceruloplasmin is decreased, some cases ceruloplasmin and copper levels are increased. The KF ring is seen in the eye. The patient should be treated with Yashada Basma. In case of Wilson disease, I have clinical trial reports where I give Yashada Basma for Wilson disease, where liver damages are reversed by Yashada Basma. Because the zinc nanoparticles, what we are preparing Ayurvedically by Shastra method is very safe in reversing liver pathology in Wilson disease. The Wilson disease has got two arms. One is neuropsychiatric problem and another is liver disorders. And both can be treated with a single rasayana, rasadravya by zinc or yashadabhasma. So I was quoting sperm count decline is also connected to the yashada deficiency. Alopecia, hair fall, khalitya palitya is related to zinc deficiency. See, cardiac infarction, ischemic heart disease also has the levels of zinc decline. Even after post myocardial infarction, zinc is decreased. In that case, Yashada Basma is Hrudya. We have another clinical trial by Dr. M.S. Dodmani, where Yashada Basma was taken trial for the diabetes mellitus. The nanoparticles of zinc are also effective in hyperglycemia cases. So in this way, we have another metallic shift theory says that if you load zinc in the body, if you give more supplements with zinc, copper will suppress. If you give more copper supplements, zinc will suppress. So zinc and copper have caused inversely proportional relationship. Nagabhasma is also having the nanoparticles, nanocrystalline size of 60 nanometer, and Nagabhasma is a very powerful drug in cancer. Nagabhasma is a very powerful drug in treating diabetes mellitus. Nagabhasma is a very good energizer in case of diabetes weakness, diabetic neuropathy. See, Nagastu Naga Shata Tulya Balam Dadati. Naga means elephant, Naga means serpent. Nagabhasma gives 100 elephant level power or 100 serpent power. See, thorium is the before one stage of lead. Lead, if it is kept into the earth for some 100 years, lead is converted into thorium. Lead is not a radioactive element, whereas thorium is a radioactive element. So thorium is nothing but lead converted in hundreds of years. So Nagabhasma means you are using a nuclear radioactive element. So nuclear atomic energy is there in case of Nagabhasma. That's why it is used in case of Krusha Prameha or Sthula Prameha. When diabetic patient will have emaciation, Dhatukshaya, Krusha Prameha is there, Nagabhasma should be given. Or Trivanga Bhasma is to be given. Vanga Bhasma is very effective treatment modality in case of Shukrakshaya, in case of low semen volume, low sperm count, in case of Shweta Pradara. Classically, Vanga Bhasma is indicated in female genital tract disorder like Shweta Pradaram, white discharge. So, Vanga Bhasma is a nanoparticle which is also effective in case of genitourinary disorders. There is a small difference between Bhasma and nanoparticle, nanomedicine. Bhasma takes place Shodhana, Jarana, Bhavana, Marana, grinding, milling and heating process. Whereas nanoparticle is vapor deposition, solid state process and grinding, milling, chemical and biological process. So the very small difference is there. Whereas Bhasma has got Yogavahi Rasayana property, whereas nanoparticle has got target drug delivery system, efficient drug release, ability to cross the blood-brain barrier in a minimal dose practice. As you know, all Maharasa and Sadharana Rasa, Uparasa are useful in clinical practice. Shilajitu is one of the Parama Rasayana in Maharasa, and Hingula is told to be Atirasayana. We have treated cases of the sensory motor axonopathy patients who have got degenerative neurological disease with a simple drug called the Shilajitu Rasayana. We use Abraka Rasayana and this Vimala and Chapala are iron oxides only. Swarna Makshika is one of the drug of choice. Swarna Bhave Swarna Makshika. This is the clinical application of Shastra. If you don't have Swarna Bhasma, or if patient is unable to purchase Swarna Bhasma, then Swarna Makshika Bhasma is effective. In one of the clinical trials, we found that the Swarna Makshika collected from Hatti gold mines in Karnataka was having very good gold trace element found in Swarna Makshika. And when Swarna Makshika was collected from copper mine area, the copper concentration was found to be more. Navasagara of Sadharana Rasa, see, it is one of the powerful Vatahara drug. Navasagara is Mutra Pravartaka and Vatanulomaka drug. Whenever patient is having a problem related to urinary excretion disorder, if urine is blocked, just take 2 milligrams of Navasagar and keep it in urethral meatus, immediately urine outflow starts. In Mutra Krichra, Navasagara and Shvetaparpati are very effective. And Navasagara can be used in case of Apanavata has got Vimudatvam or Vilomatvam. In that also it can be used. Hingula is a Sadharana Rasa, but it is told in Nigantus that Hingula is Atirasayana. Atirasayana word is only used for Hingula. So Hingula, Shuddha Hingula Kalpas can be used for many diseases. One of the promising drug is Hinguleshwar Rasa. Hinguleshwar Rasa is a powerful drug to be used in case of post-COVID-19 infections or COVID-19 prevention or COVID fever conditions. Hinguleshwar Rasa can be used. In Uparasa, Gandhaka used as Gandhaka Rasa is effective in Kushta. Gairika can be used in case of many viral infections. See, Gairika has got antiviral properties. I use Gairika Lepa in case of herpes zoster infection. In case of herpes, Gairika mixed with Takra can be applied externally. Immediately Daha, Ruja and spreading stops in 24 hours itself. Even modern drug is not available to stop the spreading of herpes zoster. Gairika can also be used internally. It contains a good amount of iron and it improves the immunity. So it can be used in case of anemia related with comorbidity of COVID-19 infection. Kasisa improves the Raja Pravartanam. Kasisa is one of the ingredient of Raja Pravartini Vati. So when Shukra Pravartana and Raja Pravartana is needed, Artava Pravartana is needed, then Kasisa Yoga should be used. Kasisa is effective in improving cholecystitis and cholelithiasis. When gallbladder blockage is there, if you give Kasisa Basma along with Kumari Swarasa Bhavana and Kumari Swarasa as Anupana, the blocked cholelithiasis or cholecystitis will be cleared. So Rudrapata Kamala in that Rasa Shastra practice is Kasisa Basma. Tankana is one of the effective drug in Raja Pravartana. Of course, Tankana is used for fungal infections of the oral cavity. I use Tankana Basma in case of bronchial asthma. It is going to scrape the bronchial mucous membrane. And Tankana Basma can be used in oral stomatitis and lung gingivitis. And Tankana Basma 500 milligram stat dose will cause Anarthava patients will improve. If you want to do Raja Pravartana, you need not go to the progesterone pills. You don't use withdrawal bleeding by the hormone combination. Give Tankana Basma 500 milligram stat dose or 1 gram stat dose. Within 24 hours, Raja Pravartana takes place. Haratala and Manashila are very powerful anticonvulsant drugs. In my Apasmara practice where epilepsy patient comes, Manashila containing drugs are effective. It may be Smriti Sagara Rasa or it may be Shila Sindura like Kalpas. Haratala is a promising drug in next 20 years. Haratala is very effective. In Ashtanga Sangraha, a lot of impression is there for Haratala. Haratala is an anti-cancer drug. Actually, cobalt 60 is a failure drug nowadays. So modern chemotherapists in the Western countries are doing research on Haratala. See, that's why Haratala is banned in Ayurveda. Whenever American people ban Ayurvedic drug, you declare that within few years or decades, they will come out with the same drug in market. Haratala is anti-cancer and Ashuddha Haratala Prayoga is used in hair removal mechanism. If you want to remove unwanted hairs, Ashuddha Haratala can be also used. Mercury is one of the miracle drug. Kajali is a catalyst and Kajali is an antiseptic. In clinical practice, you can do this trial. Kajali kalpas are effective for GI tract, hepatobiliary tract and skin disease. The Kupi Pakvarasayana like Rasa Sindhura and Makaradhwaja are for respiratory disorder. Samira Pannaga is for respiratory system and Makaradhwaja for brain and spinal cord system. So Kajali and Mercury, they are anti-aging properties, they are anabolic enhancer, they are brain tonics and cardiotonics. Whenever you give Kajali prepared from Shatguna Balijarita Rasa Sindhura, this Rasaushadhi Kajali is very effective in case of myocardial infarctions where ECG abnormalities are there. You can give Makaradhwaja or Kajali Kalpa or Rasa Sindhura, patients will develop. In case of the coronary blocks, Kajali and Rasa Sindhura or Makaradhwaja are very effective. Parada is indicated in Pandu, tuberculosis, bronchial asthma, diabetes, non-healing ulcers, skin diseases, ascites, and irritable bowel syndrome. See, the beauty of Parada is modern mercury is toxic, whereas Ayurvedic Parada, Ashta Samskarita Parada, Ashtadasha Samskarita Parada, or even Hingulotta Parada is definitely a rasayan. All these anemia, tuberculosis will be born if Ashuddha Parada is given. Modern mercury is given. All these same diseases will be cured by Ashta Samskarita Parada or Hingulotta Parada. So in Kalvi Rasayana, Kajjali, Sutashekar Rasa, Arogyavardhini are very important Parada Murchita Kalpas. The Suvarna Sutashekar Rasa can be used in acute stroke of the cerebrovascular infarction. When patient is having Vatapitta Pradhana Lakshanas and Pakshagata is there, subdural hemorrhage, a mild stage is there, Suvarna Sutashekar Rasa is effective. If Glasgow's coma scale is about 13 and 14, then you can use Suvarna Sutashekar Rasa. The reversal of infarction takes place. Rasa Sindhura dose is 60 to 125 milligram. Rasa Potali is also same dose, and Rasa Parpati is also same dose. And Maha Yogaraja Gugulu, where it contains Parada Gandhaka, and Lakshmi Vilasa Rasa. A promising drug in COVID infection is Mahalakshmi Vilasa Rasa. COVID-19 infection, the audience and the doctors can practice this. Mahalakshmi Vilasa Rasa and Jayamangala Rasa. If you give two drugs stat dose in the first day of COVID infection, within 48 hours, patients will get regression. You can try this. The Jayamangala Rasa is a promising drug for COVID-19 induced infection jwara, and Mahalakshmi Vilasa Rasa along with the Jayamangala Rasa is very effective for within 48 hours or 72 hours you can discharge the patient. In case of COVID-19 active infection and COVID pneumonia. Even there is COVID interleukins are raised when D-dimer is raised. I have given patients whose D-dimer is above 500. We have given Jayamangala Rasa and Mahalakshmi Vilasa Rasa with gold. What else you want in Shastra? For COVID-19, please try to prescribe with proper evidence. You take CT scan of the chest and D-dimer, interleukin 6 and C-reactive protein. All these are disturbed markers in case of COVID-19. And Tribhuvan Kirti, Hinguleshwar Rasa, Naradiya Lakshmi Vilasa Rasa as one prescription. Or if patient is in moderate to severe case, then Mahalakshmi Vilasa Rasa with gold and Jayamangala Rasa with gold can be used. So mild to moderate case can be treated alone with Mahalakshmi Vilasa Rasa or with alone Jayamangala Rasa. Without modern drug also we can control fever, rhinitis and pneumonia. This can be treated, and if oxygen saturation goes up to 80, we can treat with Ayurvedic drugs like Mahalakshmi Vilasa Rasa. If oxygen saturation goes below 50, then it is critical emergency condition. Even modern people have hands up there. They cannot also do much. Even with high oxygen input, patient may not survive. So oxygen saturation can be improved only by Ayurveda drug like Mahalakshmi Vilasa Rasa or Hemagarbha Potali or even Jayamangala Rasa. Naradiya Lakshmi Vilasa Rasa is also equally effective in cardioprotective, cardiac stimulant, anti-arrhythmia. If there is arrhythmia, there are two important drugs are there in Rasa Aushadhi. One is Makaradhvajavati, another is Lakshmi Vilasa Rasa Naradiya. Third drug, herbal drug is the Shaliparni or Chatushparni Prayogam. All arrhythmias can be treated with Chatushparni mixed with Naradiya Lakshmi Vilasa Rasa or Chatushparni mixed with the Rasa Sindhura or Makaradhvajavati. And Lakshmi Vilasa Rasa can be used as one tablet OD for anti-ischemic effect or cardiotonic effect. Amayika Prayoga of Abraka. See, Shadharana in Sadharana Jura, Abraka Basma plus Rasa Sindhura can be prescribed. In Jeerna Jura, Abraka Basma with Pipali Churna and Madhu can be prescribed. In Drushti Mandya, when the 6/6 is disturbed, even in COVID-19, there will be change in the Drushti, then Abraka Basma with Trifala Churna and Madhu can be given. In Rakta Pitta, hemoglobinopathies and PTINR is raised, then Abraka Basma and Madhu can be given. Abraka Basma is indicated in ascites due to the cirrhosis. In tuberculosis, you can definitely give Shatapati Abrakabasma or Sahasrapati Abrakabasma. In case of non-healing ulcers, varicose ulcers, this Abrakabasma can be prescribed. So Aragyavardhini is one important Khalvi Rasayana where Abrakabasma is one of the ingredient. Tamra, Abraka, Loha are three important Rasaushadis, and Shilajitu, Gugulu, Chitraka is one of the important ingredient. Swarnamakshika is very effective Balya Rasayana. In Maharashtra practice, Swarnamakshika is very highly used because Swarnamakshika is Tridoshagnam Balya Rasayana. It is Chakshusha. In case of retinopathies, diabetic neuropathies, Swarnamakshika is very effective. In case of coronary artery block, Swarnamakshika, Shilajitu and Gugulu, these three rasayanas can be given. In all Avaranajanya Vikaras, in my practice, I suggest Swarnamakshika Basma, Shilajitu and Gugulu. These three are very important rasayanas. It can be used in any avaranas. In case of any coronary blocks, in case of any arteriovascular diseases, peripheral vascular diseases, even deep vein thrombosis, in all these cases, Swarnamakshika rasayanas are effective. Swarnamakshika can be used in Sandra Meha, in diabetic metabolic disorders. In Rajayakshma, Swarnamakshika, Shilajitu, Abraka, Vidanga can be given. In Mutra Krichra, Swarnamakshika and Avakshara is a very good combination. And in case of Shota, due to nephropathy or cardiopathy or any other diseases, Swarnamakshika with Punarnava, Guduchi, Daru, Haridra can be used. Swarnamakshika can be safely used in tuberculosis, asthma, cardiac diseases, IBS and diabetes. Chandra Prabhavati is very important prescription in our practice. Clinically, Chandra Prabhavati can be given in all inflammatory diseases. It can be given in male infertility or female infertility. See, modern doctors give clomiphene citrate 25 mg to the male, 50 mg to 150 mg to the female. In the same way, Chandra Prabhavati can be given to male infertility, where Kshina Shukra and spermatogenesis is in trouble. Chandra Prabhavati can be given in oogenesis disorders, where ovum manufacturing is in trouble. This Chandra Prabhavati can be used in Prameha, Madhumeha, Mutra Kruchra Vikaras, and urinary tract disorders, obesity, menstrual disorders, impotence, even in ovarian cyst, whether it is hemorrhagic or chocolate cyst, Chandra Prabhavati with Krishna Jiraka can be given. In leukorrhea and renal colics, Chandra Prabhavati can be given. Chandra Prabhavati should be one of the common prescription in both male and female infertility. Give 2 months of Chandra Prabhavati 2BD, Kalyanaka Grutam for both male and female patient. Chandra Prabhavati is effective in hypertension. It is effective in Rudroga and Vrukka Roga. Hence, along with all diabetes and hypertension patient, please prescribe one Chandra Prabhavati. If you know about Chandra Prabhavati or if you don't know about Chandra Prabhavati, please prescribe Chandra Prabhavati. In practice, any patient comes with urinary tract disease, any urinary infection, urinary cancer, renal cell carcinoma, whatever may be the disease, you prescribe Chandra Prabhavati if it is classically prepared. You will get in all tumors, Chandra Prabhavati is effective. In case of chronic renal failure, we prescribe Chandra Prabhavati and Punarnava Mandura with Punarnavashtaka Kashayam, along with Punarnavadi Kashaya Basti. And we also give Ushna Jala Basti in chronic renal failure. When patient is going for dialysis, we give Haritakyadi Kashaya Basti and Chandra Prabhavati orally with Punarnava Mandura. So Rasaushadhi like Punarnava Mandura, Chandra Prabhavati, Gokshuradi Gugulu, Punarnavashtaka Kashaya, Haritakyadi Kashaya, they can be practiced in chronic nephropathy, diabetic nephropathy, renal failure cases who are on dialysis or who are want to postpone dialysis. If patient want to dialysis is done thrice a week. If you want to prevent 3 times dialysis, prescribe Chandra Prabhavati. Then you can make it once in a week or once in 15 days. Like this, Chandra Prabhavati is very common prescription for urinary calculi, gallbladder calculi, and in case of nephrological conditions. And Chandra Prabhavati is effective in spermatogenesis, male infertility, sperm count disorders, and in case of seminal dysfunctions, Chandra Prabhavati 2BD for at least 2 months is very effective. Iron pyrite, it is also very good cardiac tonic. Vimala can be used in Panduroga. Shilajitu is very important rasayana. See, it is Shita Katu combination. Tikta, Shita, Katu. It is Lekhanam, it is Chedanam, Vrishyam, Balyam, Rasayana. Shilajitu is having all trace elements like copper, iron, silver, and gold. These four trace elements are present in Shilajitu. If very good Shilajitu quality is available, Gomutra Shilajitu, Trifala Kvata is very good Shodhana drug for Shilajitu. And Shilajitu Rasayana, one of the important common clinical application is we use the Shiva Gutika. Shiva Gutika and Gugulatikta Kashayam is very good combination for all tumors. Whenever you come across with lipomas, hematomas, or any uterine fibroids or ovarian cysts, and in any case of cancerous tumors or benign tumors, Shilajitu Rasayana like Shiva Gutika is effective. If we give 7 kg of Shilajitu orally for one patient in 1 year, it is reported in Vangasena that the diabetes is reversible. So in such a way, Shilajitu is a potent rasayana. 5 grams twice a day can be used with milk as rasayana. Shilajitu can be given in low dose, 2.5 grams per day in seminal disorders, in case of sperm count less, in case of hridroga, in case of cholesterol disorders, in case of nephropathies, Shilajitu rasayana can be given. In case of prostate hypertrophy, in case of BPH, where prostate specific antigen is raised and there is increased remnant urinary retention is there, in that case Shilajitu with Dashamula Kashaya is with Madhu is effective. In Raja-Ekshma, tuberculosis, whether tuberculosis positive Raja-Ekshma or tuberculosis negative Raja-Ekshma, Shilajitu, Loha, Swarnamakshika, Grita Madhu, Haritaki, Vidanga, Anupana is effective. In Hridroga, Shilajitu and Arjuna Kvata Kashaya, very simple prescription. Shilajitu Basma available in capsule form 500 mg twice a day with Arjuna Kashaya can be given. In Staulya, Shilajitu Basma with Agnimanta Kashaya is very good effective. So Shilajitu is effective in many diseases like diabetes, IBS, hyperlipidemia. So some of the preparation like Arogyavardhini, Chandraprabhavati, Tapyadiloha. Tapyadilohavati is effective in spermatogenesis. Tapyadilohavati is effective in diabetes mellitus. Tapyadilohavati is very effective in case of liver cirrhosis like disorders. If you come to the Chapala, selenium is one of the controversial answer for bismuth and selenium. And if Chapala is selenium, it is a very good rasayana. Kharpara is also very good rasayana. In Sadharana Rasa, Kampillaka is very good krimihara. Kampillaka vati you prescribe for all krimis. See, if you want to do krimigna basti, Kampillaka should be added into that. Hingula is very good rasayana. I was telling about red sulfide of mercury. Hingula is once again Ushnam Tikta Kashayam Katu Deepana Rasayana, and it is Putra Janana Shukra Kara. See, Putra Jananam, Hingula is a Putra Janana Rasayana. Whenever you want Putra Janana effect, definitely give both male and female partners Hingula Rasayanas. Indications of Hingula are Jwara, upper respiratory tract disorders, arthritis, skin diseases, jaundice. Tribhuvan Kirti, Hinguleshwara Rasa, Ananda Bhairava Rasa. Ananda Bhairava Rasa, Kasagna is indicated in COVID-19 infections. Whenever you get COVID-19 pneumonia, Kasagna Ananda Bhairava Rasa is very effective. If you get COVID-19 with Atisara, Atisaragna Ananda Bhairava Rasa is effective. Madhumalini Vasanta Rasa is effective in Jeerna Jwara. COVID-19 Jwara, where Madhumalini Vasanta, autoimmune diseases, Madhumalini Vasanta is indicated. So in Gandhaka, we can use it as Gandhaka Rasayana, Rasa Parpati and Samira Pannaga. In respiratory diseases and skin diseases, Gandhaka combination, Gandhaka Rasayana is very effective. Gandhaka Rasayana, it is having Ajakshira, Ikshu Dandarasa, Guduchi, Madhuka, Gokshura, Varahi Kanda, and Madhu, Kushta, Brungaraja, Tulsi Bhavana is there. So, Gandhaka Rasayana is Stambanam, Vrisham, Aisham, Sarva Rogantakam. Arogyavardhini, Gandhaka Rasayana are two powerful tools in my 20 years of practice, where very good Kalvi Rasayanas can be practiced in our clinical practice. Arogyavardhini and Gandhaka Rasayana. are very effective for clinical practice. So Swarna is brain tonic, it is rejuvenator, it is aphrodisiac, anti-aging, it is health promoter, cardiac tonic, and it improves the Dhatvagni. So Swarna is Vishagnam. It is going to be acting as a toxic remover. Toxicological combinations in the body can be removed by Swarnam. Gara Visha Haram. Slow poisoning can be treated with Swarnam. Swarna is effective in diabetes, non-healing ulcers, tuberculosis, bronchial asthma. Brihadvata Chintamani. See, in clinical practice, very important. All Brihadvata Chintamani, Yogendra Rasa, Krishna Chaturmukha Rasa, Suvarna Sutashekha Rasa, all are effective in Pakshagata. But what is this concept to be used is, in clinical practice, Brihadvata Chintamani should be used when there is hypertension and Vatapitta Pradhana Pakshagata is there, Daha Ruja Pradhana Pakshagata is there, there is a infarction and small bleedings are there in the brain, then Brihadvata Chintamani should be used. When Kampa is associated with Pakshagatas, Brihadvata Chintamani should be used. When there is a ischemia in brain or in heart, Suvarna Sutashekha Rasa should be used. And Swarna Bhasma is effectively used in Amavata. Makaradhwaja Rasayana can be used for rejuvenation of dead cell. Whenever there is a dead cell, the Makaradhwaja should be given. Jayamangala Rasa, Jeerna Jwara, COVID-19 infection, acute infection, infectious fever, chikungunya fever, dengue fever, this Jayamangala Rasa can be used. Hemagarbha Potali for whenever the Nadi is Kshina, BP is down, when heart is in trouble, then Hemagarbha Potali Rasa should be given. If patient is in gasping and deathbed, you give Hemagarbha Potali Rasa. When you give Hemagarbha Potali Rasa, until its effect is there, patient will die. If you stop Hemagarbha Potali Rasa, patient will die. So that powerful drug is there. Even in Suvarna Prashana Samskara, Swarna Bhasma can be used. A very rightly prepared Swarna Bhasma nanoparticle is effective in Swarna Prashana Samskara. Swarna is Sheetam Guru Snigdam, Madhura Kashaya Tiktam, Sheeta Viryam, Vrishyam Balyam, Brahmanam Rasayanam Medyam, Smriti Pradam. In any dementia and in Alzheimer's disease, this Swarna Bhasma can be practiced. In Netra Vikara, Netra Kantikara, when eyesight is decreasing, Swarna Bhasma should be given. In Jeerna Jwara, Swarna Bhasma, Abraka Bhasma is given. In Atisara, Swarna and Jiraka and Bilvarasa should be given. In Garbhashaya Shota, Swarna, Kshirakakali and Chopachini is given. In Grahani Roga, Swarna Bhasma and Rasaparapati is given. Sutta Shekhar Rasa, it is indicated in cough, acidity, breathing difficulties, spleen enlargement, and in Raja Yakshma. And Swarna Sutta Shekhar Rasa should not be given when patient is having reaction to any one of the ingredients. So, I am coming to my conclusion. I wanted to highlight that in clinical practice, Rasaushadis, Rasa Shastra are very important. Very common medicines a Ayurvedic practitioner must keep in their clinic or in their practice is Arogyavardhani, Gandhaka Rasayana, Tribhuvana Kirti, Hinguleshwara Rasa, and Ananda Bhairava Rasa, Chandra Prabhavati, Gandhaka Rasayana, Makaradhwajavati, Trivanga Bhasma. These are all very Jayamangala Rasa. These should be one of the important kit in Ayurvedic practice. If you use these yogas, you can get a very successful clinical practice, and also you can earn money, name, fame, and also credit to the science of Ayurveda. Rasaushadhi should be practiced if they are really prepared very perfectly. If Rasaushadhis are not properly prepared, Shodhana, Marana, Bhavana is not properly done, shortcut methods are done, then they may cause side effect. For that, Ayurveda is not responsible, Rasa Shastra is not responsible. The manufacturer is responsible. The raw material in Rasa Shastra should be properly analyzed. The identification should be done properly. If raw drug is correct, then the final product will be correct. So, from pharyngitis to meningitis, or from simple viral infection to COVID-19 complications, pneumonia, or from acute jwara like COVID-19, or in any breakdown condition, the drugs like Brihadvata Chintamani, Suvarna Sutta Shekhar Rasa. Suvarna Sutta Shekhar Rasa is a fast-acting drug. If we give Suvarna Sutta Shekhar Rasa, hypertension comes down, heart activity improves, arrhythmia comes down, kidney function improves. Like this, Vyadhiharana Rasa, Panchabana Rasa, so many Rasaushadhis are there, Makara Mushti Rasa. Like this, the time is very short. We cannot finish understanding Rasaushadhi in our lifetime. So, in a given speculated time, today I have tried my level best to inspire the students, young Ayurvedic practitioners, new practitioners, to bravely or confidently start practicing Rasashastra, Vaisheshya Kalpana and Dravyaguna. You can start your career with Ayurvedic practice purely. You need not go to the cross practice or unnecessarily the integrated practice. Integration should be in manufacturing. Integration should be there in research. Integration should be there in analytical studies, and integration should be there in thinking. Not mixing of one pati and another pati is integration, according to me. Mechanical and technical study of the drug is the integration. The prescribing based on modern parameters and Shuddha Ayurvedic drug is integration. So like this, many of the medico-legal or surgical diseases can also be tried in clinical practice. You can start, if Panchakarma is practiced along with Rasa Shastra and physiotherapy is practiced, then it is a complete practice of integration. Physiotherapy and Rasa Shastra practice, and then general practice in Ayurveda. You can make your clinical practice very effective. So many practitioners are there in Karnataka, South India, where we are using many Rasaushadhis in clinical practice. In Maharashtra and Rajasthan and Gujarat are also using lot of Rasaushadhis in clinical practice. And we have used 2 generations I have studied. Aragyavardhini is given in mother and daughter, and both are not having kidney failure. I have given grandmother, grandson, also Suvarna Sutashekar Rasa. 3 generation studies we have. We don't find any trouble with Rasaushadhis. Provided, I repeat, Rasaushadhis must be practiced with Shastra Vidhi. There should not be any shortcuts. With this, I am thankful to Dr. Harsha, Principal of Shiva Ayurvedic College. I am also thankful to all the teaching faculty members, management of Shiva Ayurvedic Medical College, all the students and participants who have taken time enough to hear my few words. And thank you. Namaste.
Thank you so much, sir. Now it's question time. If anyone have questions, you can ask now. Students, teachers, if you have any doubts, you can ask now.
I think there is Pankaj Sharma.
Hello.
Dr. Pankaj Sharma. Sorry.
Sir, am I audible?
Yes, audible.
Namaste, sir, and thank you for such a wonderful lecture. So my question is, as we have a widespread notion of that the Saushadhis surpass the dosh dushya sankalpana or the vikalpana of the doshas. So what is your take on this thing that the Vedas are practicing, and what the Shastra has to say about the taking the dosha concept into while the practicing the Rasaushadhis in the clinical practice?
Very good question, Pankaj Sharma ji. Many people ask this.
Do
Very
they
good
follow
question.
the...
Yes, I have given you example now. See, there are 2 types of practice, whether it is allopathy or Ayurveda. If I am a beginner, I will ask my teacher, I will ask my guide or my guru, sir, what should I give? Then over the phone, nowadays telemedicine is there. Over the phone, he will tell, you give Hemagarbha Potali Rasa without any fear and you will get result. Because the teacher is having a perfect clinical practice and he knows this drug is effective, then na doshanam, na dushanam. Don't check anything, just give. In heart attack, Makara Dojavati give. In heart attack, Suvarna Sutra Shekar Rasa give. In case of COVID-19, you don't see anything and give Jaimangal Rasa like this, our doctor will tell. But it is not like that they don't want to consider Amshamsha Kalpana, Samprapti Gatakas and Vata Pitta Kapha. It's not like that. Our Rasacharyas were knowing everything and they have made a coding. If you give this, all spectrum of disease will be improved. See, nowadays, allopathy doctors will put, over the phone, they will tell the duty doctor in the midnight, put mannitol injection. They will not ask infarction, ischemia, anything. They will tell patient of Pakshagata has come, put mannitol, then patient will improve. And for heart attack, they will give intracardiac adrenaline injection. You give. They will not ask what is the in detail history will not be asked. In the same way, I was telling in my practice, when Vata Pitta Pradhana Pakshagata is coming, Suvarna Sutta Shekhar Rasa is effective. Vata Pitta Pradhana Pakshagata is there, Bruhad Vata Chintamani is there. When Vata Kapha is there, then you should use Krishna Chaturmukha Rasa. Like that, Vata Pitta Kapha must be there for practicing Rasaushadhi. But Rasaushadhis are broad spectrum. See, when patient of any infection comes, allopathy doctor will tell, give amoxicillin with potassium clavulate. So augmentin they prescribe, they don't ask much history, immediately they will prescribe. So you go to any modern doctor for now COVID-19, they tell azithromycin for worldwide COVID-19 infection. Whether they have checked the lung consolidation, whether they have checked pneumonia, whether they have checked tonsillitis, rhinitis, they tell COVID infection suspected, give azithromycin. Like that, Rasa Shastra people have developed. If patient is having Vata Kaphaja Jwara, Tribhuvana Kirti, Vata Pittaja Jwara, Suvarna Sutta Shekhar Rasa, Vata Sannipataja Jwara, Jai Mangala Rasa. Like this, an expert guru or an expert teacher should guide the student with Vata Pitta Kapha, Saptadhatus, Agnimandya, Amadosha. See, many references I have quoted where Bhasmas are Agni Deepaka. So then it is understood that in Amadosha, Agni Deepti is effective by Vimala, Shilajitu or Swarna Bhasma. Like that, Pankajji, we should understand Amshamsha Kalpana, Dosha Kalpana without fail. Of course, when you are in a confusion, see, for example, Kamala patient comes, there is no hepatitis B report yet come, patient is poor to do that. Then you can use Rasaushadhi, broad spectrum Kamala Hara drug like Punarnava Mandura, Tapyadiloha. Tapyadiloha is a broad spectrum anti-Kamala drug. Whether it is Panduttara Kamala, whether it is Ruddhapata Kamala, whether it is Bahupitta Kamala, Tapyadiloha works. So Rasashastra is a style like since means they have prepared the concept that, see, Yuge Yuge Dharma Hani, I was showing that. From Kruta Yuga to Kali Yuga, lot of our Smriti has decreased. We cannot remember Shata Sahasra Shlokam because we don't have capacity like previous people. When Vedas were taught only by Bharating days to remember lakhs of shlokas. Now our Ayurvedic student will not remember 10 shlokas in final year. Or even in MD final year, they don't remember 10 shlokas. Because our Smriti is declining. Our teaching methodology is not up to the mark. Then we made in a capsule that give broad spectrum antibiotics. Now, gram positive, gram negative test and antibiotics are not there in allopathy practice. Allopathy practice is broad spectrum antibiotics, third degree cephalosporins. Like that, Rasa Shastra people said, you need not much bother about Amshamsha Kalpana. It doesn't mean that don't check. You must have the knowledge of Vata Pitta Kapha, Samprapti, Kriyakala, Dosha Dusha Samurchana is a must. If you understand Rasakalpas as per my presentation, you will understand where Vata Pitta Pradhana is there, Suvarna Sutta Shekhara should be given, Brodvata Chintamani should be given. In typhoid fever, Vata Pitta Pradhana is there, Tribhuvana Kirti should not be given. There you should give Shitamshu Rasa. Like that, Amshamsha Kalpana and Dosha Vikalpana is a must. Guna Vikalpana is a must. Based on that only Rasaushadhi should be practiced. But for a beginner, I'll tell my students that when they call me, hey, you give Malla Sindhura, you give Samira Pannaga without fail. So Samira Pannaga is Vata Pitta Kapha, Sannipata, Vata Kapha, Tridosha Hara. So in pneumonia, like post-COVID pneumonia, you forget Vata Pitta Kapha, anything, and give Samira Pannaga, it works. It means Samira Pannaga is broad spectrum. This word was not prevailing at the time of 17th or 16th century. Then they said, Nadoshanam, Nadushanam, Sati Yogai Reva Kevalam. That word was told, don't worry, don't do much diagnostic confusion, don't worry. You give this broad spectrum. Understand? For that purpose, it has been given. Okay? I hope you understood.
Yes, sir. Thank you, sir. Yes, sir. Sir, one question more. Uh, sir, while as we have seen that there is mentioning of Mandal Prayoga, for example, in Kushta and Arogyavardhani. So, sir, what is the maximum duration for which a patient can be given the dosage of resources?
Very good question, Pankajji. Actually, there is no course set in Ayurveda in many instances. In case of Kuti Praveshika Rasayana, course is fixed. 6 months, 3 months or 1 year. In case of Arohana and Avarohana Krama, where you do Vardhamana Rasayana, the course is fixed. Whereas in case of other Prayogas, there is no fixation of limitation or course of the study. But our acharyas who know Jyotisha, who know Indian traditional science, they made Mandala Prayoga. Mandala Prayoga is not having any reference in Ayurveda, but it is in Jyotisha, where Chaturvimshati Tattvatmaka Purusha into double is 42 days or 48 days Mandala Prayoga was brought. Actually, in our Indian tradition, it is there Mandala Prayoga. There, what we think is 48 days continuous Arogyavardhini Rasa is given, give a gap of 7 days, and again start. This is called a breakup in the course because Satmya takes place and hence drug may not be effective or toxicity may develop. For that purpose, it is told. But I have studies where we give Arogyavardhini Rasa for more than that also. We have given 90 days also. We have given 120 days also. And in between, we check liver function test and kidney function test. Many times there is no toxicity. You can do that. Only thing is, if you are giving for longer duration, in between LFT and renal kidney function test must be checked. Otherwise, no problem.
Yes, sir. Thank you, sir. Sir, there is one more question. For example, sir, I am in my clinical practice and I am purchasing the ready-made drugs. For example, I am purchasing a Brak Bhasma from Sri Dhut Papeshwar. It is following all the criteria of Bhasma Pariksha like Varitara, uh, Chandra. Like these are, it is following the same criteria. But still, how will I know that the manufactured drug is not going to harm my patient?
पंकज जी ज्यादा डरने की जरूरत नहीं है. And one more thing I'll tell you, for all my audience, Vyaparam Droha Chintanam. This is told in Sanskrit. Don't believe on anyone. Understand? In coming days, you cannot trust anyone. I will not comment on any company. So I don't know about any company. All companies are good, all companies are bad. Your clinical trials, a repeated practice will only give you the confidence. Second is, when it comes to the question of trust, my slogan is prepare and practice. If you prepare, you are eligible to practice. If you cannot prepare, there is a doubt or there is a problem always with the company manufactured products. None of the companies are safe, none of the companies are bad. So for that purpose, some of our Rasaushadhi practitioners will do like this. They purchase Basma from pharmacy and they will give one more putta with Kumari Swarasa. One more putta with Trifala Kvata Bhavana and they give one putta and then they start using practice. That is also I have seen. But still, there is no limit for fear. See, paracetamol is hepatotoxic. Any MBBS doctor is afraid. Paracetamol is hepatotoxic. If we give paracetamol 650 mg for 15 days, fatty liver degeneration starts. But no MBBS doctor is afraid. They know that after putting steroids, sugar shoots up. But nobody is afraid. After putting steroids, puffiness comes. Nobody is afraid. They will tell this drug will do like this. All anti-cancer drugs are nephrotoxic and hepatotoxic. No allopathy doctor is afraid because they are mainstream people. They know that side effect will come. But in Ayurveda, again and again, we are afraid. It is not necessary. First importance is you give importance to you prepare and practice. Whatever you prepare, you practice. If you don't prepare, don't practice that. That is first best thing. You ask your friends to prepare and give you. You trust your friends. In your 5 people group, 1 or 2 will only do manufacturing and they will charge their money also and 3 people will practice. So you will have trust on your friends. Third is left your company purchase. I don't say any company is good or any company is bad. So it is left to your clinical experience. It will take 10-15 years for Pankaj Sharma ji to get experience. Then you decide which company drug is good, which company drug is bad. Then stick on to good product and leave the bad product. Okay.
Yes, sir. Thank you so much, sir.
Thank you, Pankaj. Any other questions?
I think there is a question by Dr. Anu. When thalassemia minor, which Rasaushadhi can be practiced, sir?
Good question, Dr. Anup ji. See, thalassemia major and minor, there is no need of iron there. Thalassemia is a disorder of mutation where suddenly the person is unable to manage with the hemoglobin percentage. It is not a deficiency of iron there. So for thalassemia, iron is not required. Don't load with iron. In thalassemia, Phalatrikadi Kashayam is very effective. Kasisa Kalpas are very effective. Kumari Asava is very effective. Ayaskruti is very effective. Like this, many drugs where iron is not there also can be used in thalassemia. No need to be using Loha Kalpas. You can use other Kalpas where you can use copper based preparations, Swarnamakshika preparations can be used in thalassemia also. And without metals also thalassemia can be practiced. Professor C.P. Shuklaji in Jamnagar, his favorite prescription was Phalatrikadi Kashayam and Sharapunka. It will improve the metabolism. It will improve the pathological sequence in thalassemia major. So blood transfusion rate will come down. Okay, Anubji, I think it's clear.
Sir, another question, sir. Sir, as we know, bhasmas are having this nanomedicine or nanotechnology like effects. So, if we give bhasmas along with kashayas or other tablets which we are giving, herbal tablets which we are giving for a particular disease, will it increase the bioavailability and target specificness in for that particular medicine?
Very good question. We do in practice. This is there. It's a secret you are bringing out. What we do is, whenever you are prescribing a nanoparticle, a Rasaushadhi, definitely we prescribe one Asavarishta and one Kashaya. The nanoparticle activity will be enhanced by Kashaya and Asavarishta. And nanotoxicity will be reduced by Kashaya and Asavarishta. And Asavarishta and Kashaya or herbal drug action will be enhanced by Rasaushadhi. So this is a mutual configuration. And Anupana is the word used for this. One drug is prescribed with another drug, it will be acting as Anupana. For example, if you are prescribing Kutaja, you should give Kutaja 12 grams for Atisara. Patient will not digest Kutaja. Then Kutaja Kajjali is prepared. The Kajjali will reduce the dose and action will be increased. Fast acting drug will be developed. Triphala mixed with Kajjali, then Triphala will be fast acting and the action of Triphala will be increased and Kajjali's toxicity will be decreased, vice versa. So it is very good to practice nanomedicines with Kashayas or Avalehas or Asavarishtas. Very good, very good.
Any other questions? Dr. Konik, can you read that question? One question came as message.
Okay.
No, sir. There is no question.
I think Giriraj is raising hand.
Ridhima Sharma, she has asked one question. In genetic disorders, we can give any bhasma for it like in GIT disorders. For like in GIT disorders, genetic disorders and Rasa medicine, sir.
Yes, yes. Vidima, it is a good question. See, we are not in super specialty yet. We are doing general practice in Ayurveda. We are struggling for general practice existence. I do genetic filter therapies. We can block the chromosomal anomaly from parents to the children. We have got clinical evidence. One of the child with 46XY anomaly was there. A girl named Pooja came to me some 15 years back. She was having cerebral palsy with mental retardation. Her father's chromosomal study showed abnormal. So due to the Bija Pradosha, the kid was suffering. We treated that baby, and after 3 or 4 years of follow-up, she started walking and improvement was there. But still some IQ abnormalities, CP was there. Their parents asked me, they want to have a second normal child. Then I said, male patient is having chromosomal anomaly. If they conceive, second baby should also be abnormal. Then they said, no sir, we want a healthy baby, whether male or female we want. Then we treated both couple for 1 year. Panchakarma Shodhana was given. Rasayana and Vajikarana Aushadhis were given for 1 year. And then Rasa Aushadhis were also given. Later on, that lady conceived. They delivered second female baby. And second female baby's chromosomal study was normal. Second baby was 100% genetically normal. No CPMR, no genetic carrying. Father was genetically abnormal, second baby is genetically normal. This is Rasayanas, Rasaushadhis, genetic filter effect of clinical practice. We can do that. Many trials we do. Some of the congenital anomalies are there in the parents. Then we give Shodhana, Rasayana, Vajikarana and Rasaushadhis for certain period of time. When they conceive, again during antenatal period we give Garbha, Masanamasi Garbha Rasayanas, then the genetic diseases can be prevented in next offsprings. Once the child is born with genetic anomalies, it is very difficult. Congenital anomaly has developed in the children. Once congenital anomaly has manifested as a disease, reversal is very tough. But we can definitely prevent generation transmission from parents to the children. Still studies are required.
Any other questions?
Hello. Hello. Am I audible, sir?
Yeah, you're audible.
सर मेरा क्वेश्चन ये है कि जैसे कि हमारे पास कुछ आयुर्वेदिक फॉर्मुलेशंस हैं, जैसे कि आरोग्य वर्णी बटी है, उसमें मतलब कोई भी फॉर्मुलेशन उसकी एक स्पेसिफिक फलश्रुति है सर। जैसे कि अगर कोई डिसऑर्डर है उसकी फलश्रुति कोई और मेडिसिन में बताइए, तो जैसे हमारे पास मॉडर्न में कंसेप्ट है कि वी हैव फर्स्ट चॉइस ऑफ ड्रग एंड सेकंड चॉइस ऑफ ड्रग, वेदर वी हैव सच टाइप ऑफ कंसेप्ट इन आयुर्वेदा आल्सो?
वेरी गुड क्वेश्चन क्षितिज कुंदल जी। हमारे आयुर्वेद में भी बहुत सारे ऐसे इंस्ट्रक्शंस हैं। वी हैव, इट इज लेफ्ट टू द फिजिशियन अकॉर्डिंग टू द संप्राप्ति घटकस, अकॉर्डिंग टू द दूष्यम देशम बलम कालम प्रकृतिम मनलम वयः सत्वम सात्म्यम, अकॉर्डिंग टू ऑल दीज फैक्टर्स we have to fix the disease specific drug. That's why you see in Bhashya Ratnavali or in Rasatarangini or Rasaratna Samuchaya, for one disease multiple drugs are there. In Prameha there are hundreds of drugs are there. In Kushta there are hundreds of drugs are there. For Vatavadi hundreds of Tailas are there. Why they are written? All Vatavyadhi chapter drugs are not for all Vatavyadhis. We have to make which is the first line, which is the second line, which is the third line, which is not available. Some patients are having anurjata or allergy for some of the ingredient. See, some of the patients are having allergy to Gandhaka. Then don't give Gandhaka containing kalpa. You have another kalpa. Nirgandha Murchana is there. If patient is allergic to some other drug, again you have another option. That's why for Pakshagata, I was telling, no, for your question, I have given an answer. Brahad Vata Chintamani, Suvarna Sutta Shekhar Rasa, Yogendra Rasa, Rasaraja Rasa, Krishna Chaturmukha Rasa. 5 Rasa Ushadhis I have told for Pakshagata. All 5 are Pakshagata Hara. then all should be mixed and given, or which should be given first and which should be given next. This is not like this. Every kalpa is prepared for a specific target. The acharyas have got a specific target. Based on that, we should choose. For Vata Prakriti, Vata Pitta Janya Pakshagata, Suvarna Sutta Shekhar Rasa may be effective. For Pitta Prakriti, Vata Kapha Janya Pakshagata, Malla Sindhura may be effective. For Kapha Prakriti, Vata Kapha Janya Pakshagata, Krishna Chaturmukha Rasa will be effective. These are the secrets. Kshitij Kondalji, these are the secrets you should learn from an expert guru. Nowadays, you should search for such expert gurus who outspokenly will tell all his secrets. Okay? Many times, Gupta Vidya is there in our tradition. Many people have not told secrets of their practice and they have died. And even textbook writers who are not knowing the password was not there with the textbook writers. They have only written the shloka meaning in Hindi, meaning in English. But only a practitioner, teacher, guru who has practiced can tell you, here you give Brihadvata Chintamani, here you don't give Brihadvata Chintamani, here you give first line of drug is Samira Pannaga, second line of drug is this. Like this clarity will be there for teacher or a guru or a first senior doctor, then only they can teach Kshitij Kaundal their secrets. Otherwise, your question is very good. But if such a teacher is not available, I know many of the gurus have got very good command on the text, but they never practice. Many of the textbook writers are not practitioners. Then your question will remain as question. If the textbook writer is a practitioner, if the textbook writer is a manufacturer, if the textbook writer is a practical person, then Kshitij's question will be answered. Otherwise not.
Okay, sir. Thank you, sir.
Okay.
So I think no more questions is there.
Hello. Am I audible?
Yes.
Hello.
Hello. Tell me, Giriraj.
Yes, you're audible. You're audible.
Good evening, sir.
Yes. Good evening.
Sir, my question is, sir, can you please explain use of Tamragarbha potli in some acute condition of hypertension, like a sudden shoot up of the BP up to 180, 190, and some other rush of also these sportive drugs in acute condition of hypertension?
See, we have admitted a case of chronic renal failure in our hospital 2 days back. Before Corona, patient was normal. He was having creatinine level 7 and we treated, patient was normal and discharged, patient was fine. But during the COVID period, he couldn't come to the hospital. 2 days back, we admitted. His BP was 220 by 110. Understood? 220 by 110. Then his pedal edema was used. He was having dyspnea. He was having acute hypertension symptoms. Then our PG scholars have handled very well that today it is 150 by 100. Are you following? In 2 or 3 days, our PG scholars have handled the BP with only Ayurvedic treatment and it has come down to 150 by 100 from 220 by 110. Is it not an improvement in acute condition? And what they have done is they have used Shweta Parpati, Mutralakwata, then some of the drugs like lepas were applied on the legs. Lepa was Amalaki Kalka Talapaduchil was done on the Shiras. Talapaduchil, Shiro Lepam was done. And patient was given Kalyanaka Gulam, 40 grams twice a day. He had Virechana. After giving Shweta Parpati and Falatrikadikwata, patient had Mutra Virechana. And only with this only patient has brought down. So, Patient is not affordable with any of the Rasaushadis or market preparations. In government hospital, in 72 hours, our PGs have developed a mechanism or a system to treat, and this patient is having a recurrent increase of or acute shooting of acute over chronic hypertension. Suddenly he goes up to 200, 220, and with Ayurvedic treatment he comes down. So we are doing Matra Basti, we are doing Kalyanakagudam, we are giving Shweta Parpati. With this only Talapaduchan and Lepam, with this only patient BP is coming down. Then there is no need of any Potali Kalpas, there is no need of gold Kalpas. It is possible. Only thing is, confidently we should be able to treat, and patient sattva should be good. Patient is never afraid. Their wife and relatives tell, whatever treatment you want to do, you do, sir. We will not go to allopathy hospital. Okay, then the alternate option is only the Ayurvedic hospital, and we are able to reduce hypertension. One of the yoga is there. You can try this. Rasa Sindhura and Sarpagandha yoga. Only two drugs are there. When Rasa Sindhura and Sarpagandha are triturated strongly, and then that Sarpagandha the yoga is given, hypertension comes down very quickly. And you should have some Mutra Virechaka drug, Vatanalomanaka drug, Virechaka drug, anti-anxiety drug, anti-Unmada drug, and Mastishka drug. If you combine all of them, you can treat acute hypertension. No problem. One of the research is also going on in our college. A PG research is going on hypertension. These trials are going on. I hope Dr. Giriraj Sharma understood this.
Okay, yes, sir, yes, sir. Thank you very much, sir.
So there is another question from Rachna. Can Rasaushadhis practice in HIV patients? And one question is, which drugs can be prescribed in hypertension conditions?
Very good, very good. In HIV, we have tried many drugs. We have tried from Hemagarbha Potali, Arogyavardhini, Shiva Gutika, Rajata Kalpas. We have tried Tapyadi Lohavati. We have tried Vajrabhasma. We have tried Rajamruganka Rasa. We have tried Abrakabhasma, Sahasrapati Abrakabhasma. So many Rasaushadhis we have tried in HIV. Not to reverse the HIV infection, to treat HIV disease. What patient is having disease, that even Talakeshwar Rasa we have used, Haratala Bhasma we have used for HIV patient. So you can use according to the patient presentation in HIV, many Rasaushadhis can be tried. Shilajit Rasayana can be tried. Next, when it comes to the another part of the question is, what is it?
Sir, hypotension.
For hypotension, see, one of the good concept in Ayurveda is Kuchala Kalpa should be used. Shodhita Kuchala can increase the blood pressure. Whenever blood pressure is going down, patient is conscious, he is able to take oral drug, then we can give Kuchala Kalpas. Like Ekanga Virarasa, Vishatindukavati, Vishamushtyadivati, we give to the patients of low blood pressure, they will improve. And also Lavana Panchaka, if you give Lavana Panchaka with Kuchala, patient's BP will improve. No problem, no hypertension. But patient is unconscious, not able to take oral drug, then we are helpless. Okay.
Sir, I would like to have one question, sir.
Yes.
We also have a reference of Suchika Varna Rasa.
Yes.
Sir, have you ever tried Suchika Varna Rasa in your practice, sir?
Good question, Dr. Harsha. What we have done is Suchika Varna Rasa, we have not tried on the Brahma. Because in an emergency, we were unable to do that Brahma marking. But we have tried where patient IV line we prick, no, it will be failed. In case of emergency, unconscious, semi-conscious patient. When we prick the needle, their blood comes, there only we have put the drug. We have put Hemagarbha Potali Rasa in the where prick bleeding comes. There we have tried, but we have not tried on the Brahma where Kakapada Janga mark is done, and Suchikapanna Rasa we have not prepared. The problem is we don't have Suchikapanna Rasa prepared, so we have not tried. Hemagarbha Potali Rasa we have tried where blood comes out, there we apply. This we do. So if anybody can prepare as Suchikapanna Rasa, definitely we are going to try this in practice.
Sir, there are only to continue the discussion, sir. Sir, there are some other discussions. There are some other narrations wherein like Ardhanari Nateshwara Rasa.
Yes, yes, yes.
Such drugs are being used. I mean, are they really used, or I mean that is what I would like.
Yes, yes. I asked about Ardhanari Nateshwara Rasa to my Guruji.
Yes, sir.
He has used this. So
Okay.
he said definitely it works. In case of opposite side, full body temperature is there. To the opposite nostril, if it is installed, the fever comes down. He said he has used this. Ardhanari Nateshwara Rasa, see, a live cobra, Naza should be used for this. And into its mouth, the potali kajali is to be kept. And then the live cobra should be subject to Sharava Samputa and Puta. And here actually our tradition, who will manufacture this? That's why the question, but my Guruji said, he has prepared Ardhanari Nateshwara Rasa and used. We can use it in ipsilateral hemiplegia and some of the Vishama Jwaras, where it can, he said it is used in Jwara. But he's telling, we are not dare enough to kill a living serpent. Understand? We are all Naga worshippers, Sarpa Radhakas. To kill a cobra or Naza, that too live, having poison, we should keep medicine into its oral cavity. So this is practically possible. It has been tried, but I don't think we cannot try this. It is very tough to prepare. If we are dare enough to prepare, definitely it can be
No, but are there any clinical?
not seen.
No, sir. But are there any clinical conditions wherein one half of the body?
That's what I'm telling you. In Shitanga Sannipata Jwara,
okay.
in Shitanga Sannipata Jwara, one half of the body will be warm, one half of the body becomes cold, and patient dies. We have seen in Shitanga Sannipata Jwara, such viral infections are less now.
Okay.
Such viral infections in clinical practice we don't get such. But some of the sudden viral infections will have that. Shitanga Sannipata Jwara, poisoning cases will have that manifestation, but very rare. Very rare. I observe right body temperature and left body temperature. If one body temperature will be less, another is raised, then we can try this. I have seen reverse of this. Half of the body upper side is having temperature, lower body is having Shita. That I have seen. But right half, left half, very rare to see. Shitanga Sannipata Jwara is very rare. Because after 50 years or 100 years, that virus will come down. That virus will disappear. So these are all viral infections. So rarely seen clinical conditions, but it is possible.
Thank you. Thank you, sir.
So can we wind up, sir?
Yes, yes.
Yeah, Dr. Badal, go ahead.
Sir,
Thank you.
On behalf of Shiva Ayurveda Medical College and Hospital, I extend my sincere word of thanks to Dr. Madhava Diggavi, sir, who in spite of his busy schedule, took time to share his valuable wisdom over Rasa medicines. Thank you, sir, for your valuable and knowledgeable session, sir. Thank you.
Thank you. Thank you, Harsha. Namaste.
Thank you, sir. Namaste.
Thank you, Ananda. Shall we leave the meeting?
Yes.
Yes, sir. Yes, sir.